Normally, I mean, we've heard some great data, haven't we, at this conference today, all about caregiving and respite and all about the wonderful things people are doing throughout the country to help family caregivers and help people who need respite services. Typically, when I'm talking about different things, like many of you who are in aging services, we begin every talk just going through a litany of statistics. And if you don't mind, since I start every talk with this litany of statistics, I'm just going to ground us a little bit by saying that we all know that every day 10,000 people turn 65 or older in this country. In less than 10 years, there'll be more older adults than children for the first time ever in the history of the United States. For the first time ever. And of course, we are seeing right now experiencing the biggest demographic shift that we've ever experienced before. So it certainly lays the groundwork, doesn't it, for this session this afternoon about this importance of these multi-sector plans, the importance of master plan on aging. I would like to just point to and read the titles of our panelists and tell you a little bit more about Carrie Graham, because I know our panelists will talk about their work and what they're doing. Our first panelist there is Donna Benton. She's the Assistant Dean of Diversity and Inclusion, Director of USC Family Caregiver Support Center, Associate Research Professor of Gerontology at USC Leonard Davis School of Gerontology in Los Angeles. Can we give her a warm round of applause? Donna, you had a cheering squad even before I got through that title. That's the dinner group. Oh. And of course, my friend from New York State, Andrew Lebwohl, Director of the Center for the Master Plan on Aging at the Office of Aging and Long-Term Care at the New York State Department of Health in Albany here. Andy. And Mindy Ulstad, the Chief of the Bureau of Senior Programs from the Missouri Department of Health and Human Services, Jefferson City, Missouri. Let's have all of the people from Missouri give her a warm round. And of course, our facilitator today, Dr. Carrie Graham. She's the Director of the Aging and Disability Policy at the Center for Healthcare Strategies. Dr. Graham oversees CHCS's portfolio of work to improve care delivery for older adults and people with disabilities. She has a special focus on those who need long-term care services and supports and those who are duly eligible for both Medicare and Medicaid. She provides direct technical assistance to 20 states that are developing multi-sector plans for aging. Dr. Graham has been working in the field of aging research, health policy, and evaluation research for more than 25 years. I'm going to turn it over to Dr. Graham.
Good afternoon, everyone. It's over 300 people here. It's absolutely amazing. And I was just thinking that the best way to keep people at a conference for the closing session is to offer lunch. So this is perfect. Perfect. So today we are going to be talking about these multi-sector plans for aging and what they are and how they can be really, really instrumental in elevating a lot of issues, but especially caregiving and respite. I do want to thank the rest of my team. They're not here today, to Shira Moffett, Valerie Flores, and Emma Rauscher, and our three funders who've made this work possible. We have May and Stanley Smith Charitable Trusts, the SCAM Foundation, and West Health. So thank you to our funders. Next slide, please. So, am I in charge of the slides? Oh. I'm not in charge of the slides. Multi-sector plan, what is a multi-sector plan for aging? And I was sharing these guys, I give this talk a lot, and when I first started giving it, I would get through like 40 minutes of discussing multi-sector plans for aging, and people would say, oh, it's a state plan on aging, or it's a state health improvement plan. And just wanted to be clear that that's not what it is. A multi-sector plan for aging is a plan that's like an umbrella that focuses on aging and disability cross-sector. So it works across all different government agencies, departments, and offices that have anything to do with aging or disability. And this means people who are aging, which is all of us. This means caregivers. This means people who provide services to people who are aging. Department of Transportation. Probably if departments of transportation and state governments look at their demographics, they're going to realize that they are serving people who are aging. Department of Housing. All of us know that housing has been a big issue for older adults. Office of Emergency Preparedness in a state. This is very important for older adults and people with disabilities. So, with that said, a multi-sector plan is state-led, but it is cross-department. So it might be led by a Medicaid agency or a Department of Aging. We'll have examples of folks from different states up here who are leading them. But the real key thing and the hard thing is to work across departments. Now, a lot of these departments and offices have their own plans, like the State Health Improvement Plan or the State Plan on Aging from the Department of Aging, and those get encompassed in a plan. A multi-sector plan for aging is not something that recreates the wheel. The first step is really to go out and find out what everybody's doing on the state side. Many states create sort of an aging cabinet level work group that has on the state side, making sure that you're coordinating and being efficient and being aware. I mean, who's ever worked in a state government that, you know, maybe the Department of Aging was doing something and the Department of Public Health was doing sort of a healthy aging rural health initiative and they had never talked to each other. So when we talk to states about doing these, you know, they have to convince their governor, and it's like, what governor would not want more efficiency and coordination across all of these important efforts? So really what we're doing is, everyone talks about state government as silos. Everyone's got their jurisdiction, right? I am in charge of this service, or Older Americans Act funding stream, or CDC funding. But people don't live in silos. People cross over the silos. People go from a hospital, which might be one agency, to a home health agency, to a supported housing environment, to being a family caregiver. So in some ways, doing this kind of plan is person-centered planning. It's about, we're looking at people as they need different services and go across government. So let's stop talking about government and let's talk about the cross-sector part of this. Multi-sector plans for aging, usually when a state decides to do it, they take 6 months or a year and they get very stakeholder engaged. They do stakeholder meetings, and what we coach states on is, let's move beyond the people who always show up to the meetings. Let's figure out who doesn't come. Let's go out and make connections with people who, you know, maybe have traditional distrust, services that haven't always been about aging, but now they are. Communities that don't speak English, that aren't accessing services. So, you know, you've got the state side, but you also have that they're very deeply stakeholder engaged, and you're figuring out what's happening out in the community around aging, right? Multi-sector plans for aging are really data informed. We work with states about just mine the data that you have. Go out to different departments, like, do they have demographics on who they're serving that are older adults, you know? Use data sets that are out there to kind of just say, what's happening in your state? What are the projections in your state? And where do we want to go? The other thing about a multi-sector plan for aging, so it's usually like a 10-year plan. It can be aspirational, and it's kind of a living document. So it incorporates all these other plans. It doesn't start from scratch. It creates initiatives that can be like, we would like our state to go here in the next 10 years. or it could have a very specific short-term, we are funding this, or something like that. So they can be really just this vision where you get all the people together. What's really nice about having a plan like this once they're developed is it allows a state to respond quickly. One example was, you all remember the American Rescue Plan Act gave states this federal matching dollars, and states had to write a home and community-based spending plan to use the dollars, and they had like 30 days to do it. States that had a multi-sector plan for aging already had initiatives and plans and ideas that were the governor agreed to, the legislature had agreed to, the stakeholders had agreed to, and it had been discussed. They were to respond quickly. And it's a living document. It's not like from 2024 to 2026, this is what we're doing, and then it goes away. It is written in that it gets updated over time. The data gets updated in terms of accountability to implementation, and initiatives that are in there usually have several different public-private partners or state agencies that are co-leads working together on something. So next slide, please. What they are not. They're not a budget document. It's not a promise that everything in there is going to be funded. It is not a state plan on aging or a state health improvement plan or an age-friendly plan, but it is an umbrella that lifts up all of these. It doesn't replace them, it lifts up what you have in all these different age-friendly plans. A multi-sector plan for aging should not create new silos. It should create coordination across silos. Every once in a while, we actually have had a couple states that they did this plan, and they're like, you know what, we need to merge departments. And so that's happening in Tennessee right now, is that they have created a new department based on their multi-sector plan, and when the new Department of Aging and Disability together launches, their plan is their blueprint. And it's not always called multi-sector plans for aging. So next slide, please. We always encourage states to make fun names for their plans. We often, say that in communication, sometimes people hear aging and disability and then they do this thing called they other it. That's not me. I don't have to, I'm not there yet. I don't do that. That's not my jurisdiction. I do housing, not aging. And so sometimes states don't even use the word aging. So we have Longevity Ready Maryland is a cool one. We have All Ages and Stages North Carolina, Age Strong Vermont, Utah for the Ages. New York and California both use the term master plan for aging. And so anyway, it could be sometimes we don't know that a state's doing a multi-sector plan for aging because they're calling it something really cool and different and we don't know. So anyway, next slide please. So when a state starts doing a multi-sector plan for aging, we always advise them to start with big, broad goals. Start with big, broad goals. And work with your stakeholders and your governor and your legislature. Can we all see ourselves in these broad goals? And I picked California's because they have a very specific caregiving goal, which is we will be prepared for and supported through the rewards and challenges of caring for aging loved ones. And so if you were on this website and you clicked on it, you would see all these different initiatives and things that they came up with. So it's just a framework for how a state puts together their multi-sector plan. Next slide, please. And here's Tennessee. Here's Tennessee's big, broad goals. They also have an informal and formal caregiving role where direct care workforce is included. Tennessee's older adults, their families and caregivers will be more secure and better prepared to meet the challenges of aging. Tennessee will continue to support workforce development efforts to address challenges for formal and informal caregivers in the state. So anything that they do in their initiatives that they'll later develop, whether they're aspirational or specific, is going to say, is this furthering our goal? So just an example of how states address caregiving, and we are going to hear very specifically from other states. Next slide, please. This is just an example of states, how they use data. Tennessee has a great data dashboard. I just didn't have any pictures of it, but using data to sort of say, where are we in caregiving in our state? And then where do we want to get in the next 10 years? Next slide. There's some stuff going on federally, interestingly enough. There's a bill by Gillibrand's office in the Senate that would have ACL provide funding to states to do multi-sector plans. I don't know that anything's getting passed in any Congress anytime soon, but that was cool that they have that. And then there's also this interagency coordinating committee on healthy aging, and they're kind of trying to do a multi-sector plan federally, like get all the federal agencies together to talk about aging and disability. So I thought that was really cool. Our map of the states is always outdated because people are moving quickly on this. This idea has taken hold. Updated map coming soon. So next slide. I'll also say to update our map and to make sure we don't put a map out that says someone doesn't have a plan and they do, we have been doing a 50-state survey. We're almost done. I think we have 43 responses. If you are from a state that hasn't done this survey, it's just to ask, are you interested in this? Are you doing this? If you've done it, what have you put into your plan, so that we can have a better map. And what we found so far is that about 14 states are currently developing, implementing, or refreshing an MPA. You know, some states before this term MPA came, like Colorado and Massachusetts, had something, basically a cross-agency aging plan already. So there were states that have been doing this for a while. All say that they are addressing caregiving in their plan, every single one of them. 9 say that they specifically used ACL's national strategies to support family caregiving to analyze that and either put in something they're already doing that aligns with that or get new ideas from the ACL plan. Many states also, when they're doing their plan, a lot of times you have work groups and have work groups that are specifically focused on caregiving. So we will be, we do also have a publication if you're interested on how to make sure you're involving family caregivers to shape multi-sector plans for aging, and that was funded by John A. Hartford Foundation and the Michigan Health Endowment Fund. So next slide, I think I'm done. Yeah, we're gonna be having our report. We are working on funding to support more states. So if you're from a state that isn't doing a plan, contact me. We're gonna be doing this learning collaborative. We've had 2 cohorts so far, and we're about to, in the next few months, try to work with new states that want to get some technical assistance doing plans like this. So lots of publications on our website if you're interested. I'm gonna come up here. All right, thank you for letting me talk about what multi-sector plans are. And I wanna, you've already got a little introduction of our panelists, but I'd like to ask each of you, thank you for being here. And starting with Donna, if you could introduce yourself and your role on the MPA state and kind of where your state is.
Okay. Donna, Benton, California. And right now, my role for the state, for a while, I was part of the main advisory board when we were developing the master plan, which was interesting because we, about, I don't know, 4 months in, COVID started, and then we had to shift all over to Zoom, but we continued, so we didn't get too far behind. Then I moved over to the DEI monitoring, so I stayed on a DEI committee, and now I'm more on an informal master plan for aging, a group where we still like to meet because we were on the initial work group. And we meet usually once a month to see how the master plan is going. So that's where we're still monitoring and giving input and looking at the revisions, and we give input back to the formal groups that are still working on the master plan through CDA.
Thank you. Andrew.
So Andy Lebwohl, I'm the director of the Center for the Master Plan for Aging. So in New York State, our Master Plan for Aging is being jointly led by the Department of Health and by NYSOFA, the State Office for Aging. My center is housed in DOH, and I see John Cochran actually. John, is that John Cochran? I see NYSOFA back there, our partners. And so we're running, it's a humongous ecosystem, actually. We just finished a work group process where we had 34 work groups with a little over 430 different people representing different organizations and communities, and we had leaders from the private and not-for-profit and research and advocacy sectors, and agencies across New York State government, all part of this process, first of all, of generating the ideas. And so one of my staff, Abby over here, just put together all of just the recommendations we got out of those work groups, and it was a little over 1,100 pages long. And then we have a town hall process that we've run across the state. We had one yesterday with the Archdiocese in New York City. That was our 19th town hall around the state. We've had a few round tables with various industry representatives. We had one with the area agencies for aging. We had one with insurance payers and hospital systems and the transportation industry and 1199, which is the for those of you not familiar, the labor union for long-term care workers, and for nursing home workers, and you know, on top of just a public survey that got more than 10,000 responses, which actually complemented a community assessment survey that NYSOFA ran last year, which got, John, 27,000 responses? And so tremendous, really bringing in all of this input because it's a big state, it's a diverse state, but really appreciating that, you know, the point of a master plan is not just to generate ideas. The point of a master plan is also to build consensus, to develop buy-in, to build the support that we're going to need to implement everything that we are putting together. And so, again, we just finished that work group process. We're consolidating everything that came in the course of that and incorporating it with the other sources of input we've had. And then we have a smaller core stakeholder advisory committee that Anne-Marie sits on, as well as Doris, and also the fantastic Linda James, who I saw here earlier. So they're going to kind of, you know, help prioritize and further refine that down to its elements. And then we have a council of 19 different state agencies who will then take a look at that and say, like, here's what really has to happen to implement it. Here's an implementation plan that we can then turn into recommendations that we give to the governor to really help guide the next decade of aging and long-term care policy, you know, in tandem with an ongoing process of soliciting feedback, refining the proposals, making sure that it's dynamic and responsive to the situation on the ground as demographic and economic and technological realities evolve over time.
Thank you. We did those on purpose. We have Donna, who is in a state that they did their plan in the like second refresh.
Right.
New York, which has done a lot of aging stuff that is in its development and stakeholder engagement phase. Mindy, introduce yourself and tell us where you are.
Absolutely. My name is Mindy Ulstad. I'm with the Bureau of Senior Programs with the Department of Health and Senior Services in Missouri. And I am the state lead for the Missouri Master Plan on Aging, which we're calling Missourians Aging with Dignity. Oh. We started off our process. We're doing a longer process than most states. We're doing a 3-year process. We want to be intentional and make sure that we're getting adequate input from all of our stakeholders and all of our constituents. So we started our first year with working with our stakeholders, and we got them into 7 main goal areas, and then they broke into their own work groups to develop goals that they thought would be appropriate for Missouri. So they spent the first year really digging into what's currently going on in the state, where the gaps are. They were looking at data and best practices across the state, across the nation, and you know, worldwide. And they did similar to New York. They put together a list of recommendations at the end of 2023. And the reason we wanted that, one was for transparency for all our constituents to know what we've been working on, but we also wanted to have that to take to our town halls. So they could see what people, our stakeholders were saying, and to see, you know, give them some ideas of where things were going. So the next piece we did was we did 10 in-person town halls, 1 in each of the area agency on aging regions, and then we did 2 virtual town halls for those that couldn't attend the in-person town halls. And we ended up with over 1,700 people attending the town halls with over 15,000 comments. So it took a little bit of time to get that parsed out and analyzed, but we then lined that up with the recommendations that the stakeholders had put out. So we had the town hall comments lined out with the stakeholder recommendations, so we could tell them where they needed to start working, the areas that people in the town halls recognized that they hadn't thought of, and then the areas that were in consensus too, so that they knew they were on the right track in those areas. The next piece that we're doing is we're kicking off a statewide needs assessment survey, and that actually kicks off June 10th. We're doing a huge media release to go in coordination with that, because as you guys know, we spend a lot of time telling seniors not to give out information over the phone, and we're going to be calling people. So we want them to know it's legitimate, and that we do want them to answer the questions. So one of the other unique pieces that we're doing with that is we are making sure that up to 2,500 people can have assistance in person, over telephone, or video assistance in completing the application. We also had the survey translated into the top 5 languages to make sure that we're being as accessible as possible, and then the website itself will also be accessible. It will also be available on cell phones. So we're trying to include everybody as much as we can in that process. So once we get that data, we then will compare that also with the town hall recommendations and what we got from our original stakeholder group. And those stakeholders then will continue to work on recommendations, and they'll work on those till the end of this year. And at the same time, they're pulling in data that we have available, seeing where we need to start collecting data on the issues that we're looking at, to make sure that when we go to write the plan next year, that we have all of that to put together, so we can build the dashboard for the data, that we have a plan that is meeting the needs of what Missourians are telling us they need now. And so we're really looking forward to getting that survey data and just getting this process moving. It's been very good.
Yeah, we always tell states, oh, go out and collect all this data, and then they're like, how do we analyze it all? It's fun to collect the data, but then synthesizing it can be a lot. I'm gonna keep with you,
Sure.
Mindy, because you're in this development and stakeholder engagement phase. How are you addressing caregiving? And what have you, how have you made sure that caregiving is part of this stakeholder engagement time?
Absolutely. So when I'm talking in the public and we're putting information out in the media, we're telling them this, even though it's called a master plan on aging, it's truly a plan for older adults, adults with disabilities, and their caregivers, and all of us as we age. We also have a specific committee that is dedicated specifically to family caregivers. That's one of the 7 committees that we have working. And we're making sure that we're pulling in all the family caregiver coalitions in our state, working with the family caregivers that we know are involved with the foster care system, with our AAAs through the Title III programs, and just trying to get the information out as much as we can so that we can get them on board. The other piece that I'm doing is we have an advisory council and we have our work groups, but another piece that I'm doing is putting together an ad hoc advisory council. One of the things that we heard during the town halls is we didn't have enough people with lived experience on our advisory council, and that was true. We really went with the state agency directors and with statewide experts in the areas that we knew we needed to work on in Missouri. So family caregivers of each one of the 4 Older American Act populations are part of that ad hoc advisory council, as well as our silver-haired legislature, so older adults that advocate for other adults in the state. And we also have individuals with developmental, physical, and any other disabilities that want to be a part of that. So making sure that we have that lived experience to be part of the recommendations also.
I'm really glad you mentioned that. I think, you can hear such different things from people with lived experience than you can from their providers or
Absolutely.
even the sort of professional advocates, right?
Absolutely.
I'm going to hop over to you, Donna, because as a director of the Family Caregiver Resource Center, you brought a lot of caregiving expertise to California's development and implementation process. Can you say something about that experience?
Well, it was interesting because we had initially, it was the Stakeholder Advisory Committee. Mm-hmm. So and then they fed into there were all the agency heads were meeting separately, and then there was the Stakeholder Advisory Committee that I was on. And when we did the initial recommendations from the Stakeholder Advisory Committee, caregiving, although we had already had a plan for family caregivers in California that I had led earlier, and so we fed a lot of those recommendations into the Stakeholder Advisory Committee. But when the final stakeholder advisory recommendations came out, caregiving wasn't a priority. Okay, you may not remember this.
I don't remember this.
But I do.
I'm ashamed.
Yeah, however, what's interesting is when it went to the cabinet people and what you see, goal number 4, that came out of the state cabinet because I think everybody in that room was a caregiver. And they said, what? We need to break out caregiving separately. So I was it was in the body of what we turned in, but it wasn't one of the top 5 priorities. And so then they made it into the Caregiving That Works, which had 2 levels, those for paid caregivers and those for family caregivers. So I always remember how happy I was when I saw the final one that had goal number 4 listed, even though it wasn't a priority that came out of the stakeholder advisory group.
Yeah, fantastic.
So that's how we got caregiving in there.
Yeah, and I think it's a perfect example of how, California also had this like a dementia work group going on.
Yes.
And they had just done this family caregiver report, and like that doesn't need to be redone. That is work that has been done that should be elevated through your multi-sector plan, not recreating the wheel. So I didn't remember that, but I'm so glad that happened.
Maybe I shouldn't put that on. Cut that off.
And you were saying the silver-haired legislators.
Yes.
Do they know they're called silver-haired legislators?
They do.
Okay.
Yes.
People with lived experience.
Yes.
That's
absolutely.
Great.
Yes.
So, Andrew, can you tell us about New York? And I know there's a lot of work in caregiving just generally in New York, but how are you bringing that into your development?
I'll get to that. I just want to say that I've spoken with Mindy before, and the silver-haired legislature thing in Missouri is actually really cool. And I'm glad that you brought that up again, because
That's really
people
cool.
should look into that. It's a really cool program.
Are you included if you color your hair? Or?
Yep.
And actually, I mentioned Linda James earlier. Linda was one of the co-chairs of our informal caregiver subcommittee. So we had organized under 8 subcommittees, and informal caregiving was one of them. And then there were 3 work groups under that. There was one on caregiver supports. There was one on communications, because one of the things that we was that we really wanted to engage with was the fact that so many caregivers don't even self-identify as caregivers.
It's a wonky word.
And then we also had a work group on kinship caregivers, because that's also a dimension of it. When you're talking about older adults, they're not just receiving care; they're also often giving it. And so, we wanted to make sure that we were engaging with it on multiple levels. We have recommendations in the works that address all of that. It's 3-dimensional. It's 360 degrees. And so the respite system in New York State also is in different parts. There's part that's administered by NYSOFA. There's part that's under DOH. And so it's also part of our effort to really document all the programs that are out there that target or disproportionately impact older adults and people with disabilities. Just to even have the information there, which again, for
Right.
caregivers, even to have a consolidated place where they can see all the benefits that are available and how to apply and who's eligible and what it all is, would be just such a sea change in terms of accessibility for those benefits. Mm-hmm. So, those are the fronts on which we're addressing it, but, informal caregivers have been a major priority for us from the start. And I assume someone's going to name check it at some point, but the AARP number of $600 billion a year that the U.S. gets as the value of, informal caregivers, that it's been a major priority from the start.
I like what you're doing with the public-private partnerships too. We have a couple of states, Colorado and Iowa, are working on plans, and their governors are very focused on age-inclusive management strategies, which is working with the biggest employers in your state and saying, how do you attract and retain older workers and caregivers? What are policies in companies in your state that can make it easier for your employees, who are probably almost all caregivers in some way, to continue their their employment with you and their contributions. So I think that that's a really cool sort of a caregiver focus that's not so service oriented, but you know, the employers can be really powerful. So, we want to talk about equity now, and you know, I think I mentioned you don't want to make a plan that's kind of the usual suspects, a plan that is just the voice of the most powerful advocates, the biggest industries, you know, and having lived experience and all of that. But I just wanted to I'll start with Donna. You know, your approach to equity, there was a kind of a big change when California was in development.
Right.
To have a focus on equity.
So there's another lessons learned. As we were working, we didn't have an equity work group separate from what was going on. And so then some of the leaders in our regular stakeholder advisory group went and said, you know, we need to have a way to evaluate equity, and equity being in the very broad sense, not just looking, as you guys learned from one of the workshops, you know, we're not just talking racial categories, but we're looking at economic equity and where people live, all of these, you know, different ways of looking at through the lens of equity. And so we developed the equity work group, and then they came out with principles that were, and this was from Cheryl Brown, who was a former legislator in California, and she said, our principle is that equity is going to be baked into everything we do, not sprinkled on. And that was what we were able to provide, so that we came up with, you know, kind of like a good checklist that each group, as you were developing the sections, making sure that it was baked in. So equity is really spread throughout all the plans, but it's so seamless that we looked, and that became out of the data and where it was. So you'll see equity discussed in different ways throughout all the 182 recommendations.
Tell them about that equity tool.
Yeah, that's what that equity tool. So if you want, I mean, I think that's somewhere on our website. You can get the equity tool, which is a really great checklist, but it tells you, like, what do you need to think about in terms of equity, and why is it important as part of a state plan. So go online. Absolutely, there's the equity tool. And it's not hard. You know, it's just like when you say, you know, am I ready? This is kind of the, what do you need to be ready for equity while you're developing your master plan?
And I'll share that my organization, CHCS, kind of borrowed that. And when we're thinking about taking new projects, it's just a series of, we kind of modified it, but we're thinking about new projects. Questions like, who does this benefit? Who does this leave out? You know, just at least asking yourself that when you're coming up with all these ideas, going through sort of an equity checklist of saying, if it is just focused on one, like, at least let's be aware of that, you know, and just making sure, how can we make this more equity focused? How can we include people with lived experience? You know, just pausing and thinking through those things has been really helpful for us as well. So thank you for that.
It's the questions that you
just
ask yourself.
Questions you ask yourself.
Just questions.
Andrew, what about New York in terms of equity focus and?
So, you know, early on, we got feedback that we needed to make sure that we were being more inclusive with who was being brought into the program. And, you know, that's how we ended up with 430 people involved in our work groups. We really wanted to make sure that every community had a chance to have their voice be part of this process. It was very important. You know, I think, I was about to say New York, but New York is not particular about this. California has this, Missouri has this too. There's tremendous regional variation, right? And so, you know, as we look at how we're addressing the very different needs between, you know, being in the 5 boroughs of New York City and being in the Adirondacks, you know, it's looking at our geographic diversity. It's looking at diversity on all the levels, socioeconomic diversity, racial diversity. Making sure that that the disability community is part of the conversation. Also, you know, part of this process was continuously refining our understanding of all of the different influences that lead to people's differentiated experiences in this process. and making sure that they're part of this conversation. Also, I forgot there was one other informal caregivers work group that I didn't mention because I just had misplaced it in the subcommittees. But Alex Drain, who I know you all heard from yesterday, was also the chair of our finances work group for informal
Interesting.
caregivers.
Right. What about Missouri?
Yeah, so Missouri is a little unique to a lot of places. DEI is a bad word in our state. We are not allowed to say that out loud, I'll be real honest. So we have to be a little unique in how we do things. So we are running the Master Plan on Aging through our Office of Minority Health and Health Equity. We also have the Paula J. Carter Center for Minority Aging that we're working with rural health offices. To make sure that we are being as inclusive as possible without actually being able to have a committee. So if we had a committee, we might get shut down altogether. So we're trying to be very creative, but be very inclusive at the same time. So just being creative in the way that we're getting that feedback and making sure that we are being equitable.
So we talked about how MPAs are like cross-agency, and that's hard. I mean, it's really hard. You know, if it's led by a Department of Aging that typically is not sort of like powerful or moneyed in the hierarchy of the state government, right? And every state's different. How do you get other agencies to talk to you? So I guess I want to start with you, Andrew. How are you managing the sort of working across agencies and departments and all of that?
That is a great question.
It's a skill.
You know, we had an executive order that established the MPA, right?
That's
so
helpful.
we have, and it's been, the governor's office has been a tremendous source of support. They've really helped us move the needle on everything. We have an MPA council. We have these 19 state agencies that are represented on there who, you know, are officially in this and part of the process. Over the course of time, there's been a range of engagement, but that's also one of the benefits of having a staged process is that when you get to the end of a stage and subject areas are being name checked, all of a sudden the agencies get the opportunity to see that if they don't participate,
Right.
there are going to be recommendations that affect them that they were not part of the conversation on. And so that's a big motivator also to make sure that they get involved.
Having a governor's executive order is good because it sort of says to all the agencies, you got to work on this. So. Mindy, I'm just wondering, you know, I know you've done excellent work across agencies, and has that worked to break down any silos in your state?
It absolutely has. I would say as the Division of Aging, we kind of felt like, you know, the secret organization. But because of the governor's executive order, he required every department director or their designee to be part of our advisory council, and that has been huge. We have seen great work going on now, new collaborations and things that we're able to act on now, as well as helping each department plan for aging and the programs and services and policies that they currently have. It's been great.
Donna, anything to add about California and the silos?
I think, you know, we did a similar process, but one thing that actually I think is nice that came out of it is that one of the top recommendations that came from stakeholder advisory all the way through to the cabinet was to establish somebody in the governor's office that would monitor the plan and make sure that this 10-year plan didn't go away so that they could work across all of the departments. So we were really happy when that was the first, well, California, we have no money now, but at the time we had money and we established that office, thank goodness, a couple of years ago while we had money. And we have somebody who's there who actually led our master plan for aging stakeholder process, and then she moved into there and we're just like really happy.
Yeah,
Am I saying that right, Kim?
Yeah, it's the first time California has ever had a cabinet level person over aging and disability. And so that's really, you know, a system change kind of thing. As I mentioned before, there's several states that kind of do these plans, and then just through the development process is, I'm glad you're taking 3 years, because the development process, a lot happens. That's kind of where the action happens. And so you end up with states who, you know, restructure their government because of this, new departments, new merged departments, new merged efforts, and, you know, write a grant to someone and talk about how it's going to be working across, you know, agencies and, you know, governors like efficiency, and coordination and all of that. So, I'm wondering if we should open it up for questions.
Or comments?
Anybody have a question? Yes, please
I'm
come
laughing
to the.
because I'm always at the microphone. We need a lot of help in Idaho, is all I can say. So we've made several attempts. Well, we've presented the idea of coalescing a group to build a multi-sector plan.
And what state are you from?
Idaho.
Oh, great.
And we've made this pitch to the governor's office, and they've invited us back several times. We've put together a budget for the initial assessment process, but we can't get the governor to move to an executive order. So wondering about the other strategies, I believe that's essential, honestly, but I don't really want to just sit back and wait for that to happen either. So wondering what other approaches or strategies others would recommend of how we build that momentum or the pressure, the political will to take that step to do an executive order.
I mean, I would say some states have legislation, and then other states, sometimes the governor just makes mentions it in the State of the State address, like a declaration or something. Sometimes there's a secretary of something or other in the state who has sort of that power too. So kind of looking down the chain, that it doesn't have to be the governor, it could be the Secretary of Health and Human Services or something like that. But
Yeah. And we had the private partnership because they started with a survey. And then I think one of the things that I always remember is that they started because it was an election year. And so they started talking. They would ask the question, what are you going to do about aging? And so we got a promise during the election that, yes, that's going to be a priority. And so then the advocates held the current governor to that promise. So you may plan for doing it early on, get the surveys out there, but there was really this good grassroots push, which sounds like you already are doing, but maybe get that on, while they're at one of those wonderful.
some states have a Take a Pledge campaign where they just have people go on and say, I stand with seniors, or I want this, or something.
In New York State, we have the MPA Coalition. And I think that they were also a big part of generating a groundswell here. I know several people in this room because of their activity on the MPA Coalition, led by Nora O'Brien-Surik and Bob Blancato. And so, MPAs need to, public-private partnerships are going to be part of an MPA process, and why not get that started?
Anything to add?
I don't.
You guys got through your executive order.
We got the
so you were
executive
good
order.
to go.
Yeah.
Other questions?
Yeah, Donna, do you mind if I direct this to you? Because California is further along. Can you tell us one example of something that's happened since your plan has been developed and implemented that's a positive thing for aging?
Oh, sure. Well, I can start with caregiving because I think that was very positive. Within the first year after the recommendations came out, we have a statewide system of family caregiver resource centers that were significantly underfunded, and because of the recommendations, we were able to successfully get augmentations for the California Caregiver Resource Centers. Now that's one because that was close to my heart. But I think on every level, on all five goals, funding came through before we went bankrupt, came through during those years. And that's really made a huge difference because it's allowed programs to embed themselves. There was a better look at what was coming from the feds that could be matched. And so that was extremely helpful, and that doesn't require local state funds. And I think there's a larger sensitivity to not, which usually happened, cutting the aging and disability programs. Those are the ones that were always goodbye, you're gone first. And we've gone through downturns recently, and even during this major downturn we have now, we're losing very minimal impacts to the aging programs, and the ones that are there, we are fighting really hard that those will get reversed. But they haven't been touched in the last 2.5 years since we've had the master plan. So it's really been a very strong focus, and we're going 2030 gangbusters.
I just wanted to add too that even though we don't have our master plan done, we're already seeing positive effects of just having everybody together. So one of those is, of course, the collaboration between the departments, but Christina here at the front, she leads our caregiver initiatives in Missouri, and we were hearing that we have a shared care tax credit for caregivers, and it was a difficult process for caregivers to fill out. So we were able to take that opportunity to train our AAA staff and to train our contractor that does some of our Alzheimer's caregiver stuff to be able to walk them through that process. And then we also were hearing that people didn't know about the resources we had. So we pulled together a 5-page spreadsheet of resources for caregivers. So you don't have to wait till the master plan's done to actually reap benefits. So I think that's something that's important to remember.
Yeah.
Thank you. Next question.
Yes, as you talk about caregivers, are you including kinship caregivers in that plan?
Absolutely.
Yes.
Absolutely, kinship caregivers, because it's California for all ages and stages. There's another plan and so that absolutely, and of course in the master plan it's under, I think that's under number 4, and in another kinship care is under 4 and another one in California.
Thank you.
Any other questions? We could bring microphones over if someone doesn't want to stand up. I can ask a question about public-private partnerships, and I start with you, Andrew. What has been the impact? What are some of the main public-private partnerships that your state is, and what is the benefit of that?
It's a great question. I'm trying to think about where to start with it. The state can't do everything directly and independently. I almost kind of wish that John were up here to talk about the way that NYSOFA's network of AAAs work with local providers in the course of administering aging services, and certainly over in the healthcare system, understanding the way to structure things and working with different formats and structures of service providers and care providers is critical to understanding how care is going to be delivered, how we're going to pay for it, how we're going to do it efficiently and reach the populations that we need to. I think in the course of doing our master plan in particular, we hit a challenge with New York State procurement rules and the degree to which that we could engage with, for example, philanthropy. I think it's prompted us to actually look at what those rules were that stopped us from doing things in order to see if we can make changing those a part of the master plan so that we can facilitate more of that in the future. But I think also, among the recommendations is a real appreciation that we need to partner with, particularly, for example, for caregivers. We need to work with employers and make sure that there are protections for caregivers in the private sector. It's 360 degrees, right?
Yeah. I think even just in a plan that says, as one of their initiatives, we want to continue to promote age-friendly health systems and geriatric emergency departments. They could just say that. This is a great model. We'd love to promote it. And it's not really a partnership. It's not funding them, but it just starts elevating some of the things in different sectors that aren't necessarily government run, but that they want to just say, hey, we endorse this, kind of. Yeah. Anything in public-private partnerships?
Yeah, so we're working very closely with our workforce development boards and the Chamber of Commerce to try to get businesses more active into the master plan on aging. And I'll be real honest, we're not having a whole lot of luck, but we're pulling some champions in to help us be able to get that to go a little smoother. But one area we're working very closely with the public-private partnership is our direct service workforce providers. Missouri, like most of the nation, is in a workforce crisis with our direct care workforce. So we are working very closely with them on how we can build that workforce. We're working with the Geriatric Workforce Enhancement Program, also working with several other partners. We're working with Advancing States and doing the Direct Service Advisory Panel, so we're kicking that off next week. We also did a couple of surveys with the direct care workforce to figure out how we can stabilize and strengthen that workforce. So that's probably been the biggest partnership we've done with the private sector at this point.
All right.
Yeah, foundations have been wonderful.
Yeah.
And, you know, going back to the question about what else have we done for family caregivers, I want to mention the paid family leave, which we had already had in California. But because of the master plan for aging, the paid family leave advocates, as they began to tweak like how many, you know, more weeks or who could be eligible, they started quoting the master plan for aging in with the mothers groups. So suddenly they began to recognize, oh wait, the master plan for aging is there, and so they began to use the statistics around caregiving in their advocacy work, and it actually we've had lots of changes under our paid family leave program, particularly around equity and for lower income, so that there's a higher reimbursement rate now for people. Up to 90% of wage replacement went through, and then that came out of some of the statistics related to caregiving. And
That's fantastic.
So that was like, and I've been with them since we got it, and until the last 4 years, I was just kind of the lone voice there in aging and with all the moms groups and breastfeeding. And then suddenly they all realized as they age that now they became caregivers. And they're like, what were you saying about that caregiving stuff? So it's been fun.
That's fantastic.
I've aged with them.
One of the things about working across agency is it's not like a Department of Aging goes out and says, hey, public health, you're doing us a favor working on this. What is happening is the aging focus can help the other departments, right? We can give you advice on how to talk about aging, about how to use the right language, how to talk about and engage disability and all of that. And so this is really an example of how it might at first seem like, great, I'm in the Department of Transportation, I've got to do this thing. But eventually the those relationships make it so that the aging folks are advising the Department of Transportation and making their lives easier. So we have a question.
Yeah, you basically just talked about, I'm just curious how you're coordinating like engagement with other plans such as the state transportation plan, and if you're getting your information to them because they need it. And I love this multi-sector thing. So yeah, first about the community engagement, because there's so many plans that are being developed. So how are you all working together? And then specific to the transportation plan.
Yeah, I can start. So we, before we did anything with getting our advisory council together, our subcommittees, we did a scan of what state plans, what area plans, community plans. We wanted to look at all of those and see what was out there. We also looked at all the needs assessments that were available to have a starting place. But we have worked very closely with transportation for a while, but this plan has really opened their eyes to the aging population and how they're going to have to start changing what transportation is available and how they're providing transportation for the aging population. So that's been great. I did the Idaho question earlier too. I did have a thought. So one way that we've pulled in some people that necessarily would not have been involved is we've been doing reframing aging training and teaching people about, we're all aging, everyone's doing it. You know, you don't have to be 60 to start caring about aging, right? We're all aging and we all need to be planning for that. So that's something that we started in Missouri, and we're slowly getting all of our workforce trained in reframing aging, and that trickles up to our legislators too. So that's been very beneficial.
Anybody else have examples of just incorporating other plans and efforts or challenges doing that?
New York State's developing its Ulstad plan at the same time as the MPA, and we've stayed in regular touch with the Chief Disability Officer of the state, Kim Hill. Her staff have been on many of our work groups, But you know, it's still ad hoc. But you know, the important thing is to have the open line of communication so that we can identify when that kind of coordination has to happen.
Yeah, and we've pulled in some of our other partners into the Master Plan on Aging Planning. So our Alzheimer's State Plan Task Force, a lot of those members are in our Family Caregiver Subcommittee. Our Transportation Task Force and the plans that they've done, a lot of them are on our Transportation Subcommittee. Our folks that we work with in labor doing their, our CSEP state plan and the WIOA state plan are in our Daily Life and Employment Subcommittee. So we've really tried to pull those partners in so that they're working on those things at the same time. And in addition, Missouri is trying to develop the No Wrong Door again. We had one a long time ago and it didn't go well. So we're working on that plan, and we're working on the master plan and that No Wrong Door plan in coordination. So it's very intentional as we're working through each of the pieces of the master plan. We're figuring out how that can work with the No Wrong Door system. So trying to build on those things.
So much overlap there.
Yes.
I know that the ACL in their most recent No Wrong Door grant specifically said in the RFP, you can use this to sort of map aging initiatives for a multi-sector plan for aging. So there really is a lot of awareness that this mapping and knowing what's going on. One strategy we often have seen states use is if you're doing an MPA stakeholder meeting, invite the Department of Transportation to come and just brag about what they're doing. Yep. Give them a forum to talk about what they're doing that might overlap with older adults. So, come and share. Let's elevate what you're doing, which is another way of framing it of we are not here to, take up all your time and make you work for us. We're elevating what you're already doing. With these demographic changes, not many people are doing anything that doesn't involve older adults these days. So.
I think one thing that's also been helpful is that you saw that we had the dashboard, the data dashboard. And what's interesting is that if you look across all the departments, when they begin to look at the dashboard, you can see the gaps. And so I would say that that's one of our largest challenge is to find out, are they collecting anything on aging? Are they collecting on the intersectionality of aging and disability aging and race aging and where you're living and your geographic thing? So many departments, the data dashboard is we don't have that data yet. We don't have that data yet, including in caregiving. So that's actually forcing people to, again, come to the table and say, okay, can we start looking at, can you begin to collect this data? Or we found out, oh yeah, they have that data, but they just didn't tell anybody.
Yeah. Or there's no data use agreements, they can't share it. Right. Yeah. So we've had states where the MPA results in a statewide data use agreement so they can share data. I mean, fundamental, just yeah, we have data on this, but they actually can't transfer between departments. So just small things like that. The data dashboards are definitely a data gap analysis. Because you say ooh, and we were actually in California when that was first done, there would just be empty pages. We'd love to have data on this. So that was great. How are we doing on time? Are we? Yeah. Any other questions? Anybody want to come up to the mic and ask a question or share something in their state of, something that they've been working on in multi-sector planning? Yay.
Hi. I'm with New York. We're in the middle of the master plan. And I wonder, what success has California had in collecting data from community-based organizations that are sitting on data and have little or no way to really fill those gaps in? Is there any kind of mandatory reporting? Is there any kind of built-in reporting, funding for reporting, just so that the little guys can tell the ones on top how it's going as it progresses? Kind of like taking a temperature as you go. Is that happening at all?
I haven't seen that, specific program data. I've seen in the California dashboard and other dashboards how many, social service agencies or, and how many people are being served maybe. I think there could be issues with actually transferring, data from their participants. There's new rules that have just come out with the access rule federally. You have to report wait lists for HCBS programs, which is going to definitely should be in a dashboard when that starts happening. But one thing that was in the executive order in California, strangely enough, the executive order required two stakeholder subcommittees, one on LTSS and one on research. And many more committees happened, but those were required. And so it was really lovely. We were able to go out and just go to all of these institutions in California, these academic institutions with all these researchers who studied aging. And like people, I at the time was an academic and worked in the University of California system, but there was like, wow, there's a researcher in Stanislaus State who does this or that. We found, I had never heard of him. I had worked at UC Berkeley, and there was a transportation research unit, and they had all this data on transportation and accidents and driving and things like that for California that no one had ever heard of. Yeah. There's also at UCLA, there's a California Health Interview Survey that's just sort of the survey they do all the time, every few years. And there was a caregiving module that had been done, 10 years ago. It's basically asking people if they're caregivers and all of that. And the state was able to say, you know what, we don't have this data on caregivers. So they paid for them to re-up the caregiving module in the next version of this statewide population-based health survey.
Right.
And so we were able to get that, and I know you were instrumental in that.
Right, yeah, so we have, we call it CHCS, but also speaking to you directly about program data. So in California, we're one of the few that still has the California Caregiver Resource Centers, and we have data on our users, and we've been putting out reports for the last 40 years on that data, and more recently, because of the augmentation, we focused on a new system called CareNav, and that collects data around what's going on. So we've been talking with the larger systems, like maybe that they may want to look at this program data that gives a different description of people who are using caregiver services. So that, for example, we have data specifically about intensity. I think you saw that in one of the things around that intensity of care. And compared to other states, like we're super high on intensity. And then we looked at it cross-sectionally, and the API community and the Latino and African American community, again, had higher, but in different areas of intensity based on ethnicity. So those are that's interesting data, and we're trying to make that part of the data dashboard, possibly. So what you do have to do is, and you already said it, funding. Because as CBOs, we know that we can do a lot of things out of our heart, but if we don't have funding, we're not going to be around to keep doing things out of our heart. So don't give away your data until somebody funds it.
Yeah.
I'm sorry,
Good
guys.
point. Hey, are there any academics in the room, or professors or researchers in the room? There we go. And have you ever gone to a conference and they always have like, how do you translate your research into policy, right? And it's a very simple answer. You talk to the policymakers. And it's so hard. There are different cultures, and in academia, I'm an academic, we ask questions in our research that are like missing in the academic literature. We don't think to talk to the policymakers and say, what are the questions you need answered? So putting together this research subcommittee was like, gosh, we have all these amazing people in our state. You're all from states that have amazing academic institutions with people studying aging or workforce or caregiving. And so let's just bring them in a room and then have them start talking. Like, how do we talk to each other? And so it was so beneficial. The researchers got together every month. They traveled to the meetings. They were not reimbursed. They loved it. And, then they'd write grant proposals, talk about funding, and say, hey, the state wants to do this, and it's going to impact the state in this way.
The researchers.
Any foundation partners? Foundations want to fund things that they know are going to be impactful. And so to say, yeah, I want to do this research project, and the state's going to use this to design their program, their research project is a lot more likely to get funded.
Right.
So it was a really win-win situation. The academics loved being there. They learned a lot about how, yeah, I mean, I can't just get $3 million and do a project and give you results in 10 years, right? We need to say, what do you need to know? How can I get you this data? How can we be talking through the process? And, you know, there was a lot of relationships and learning, and the research group still stays on.
Yeah, we're
They have
still
some
meeting.
fancy name like Research Consortium, which sometimes you have to do with academics. You need to give them a fancy name to put on their
I think
resumes.
our most recent thing that we were able to add is on the dashboard. We're looking at the indices of what are we going to have for indexing success for the master plan. And so that was our latest
Right.
thing that each group did. So, you know, like, how do you know that you've done something for caregivers? One is like have 1 million people trained in who are going to be working professionals or, you know, for family caregivers. So that's a number. Like, how do we get to this million number? So within that, it's like how many people can be educated. And so now we have Cal Grows, and so they're going to be able to measure how many people are going through training who are direct care workers. How many direct care workers have you trained in blah years with basic knowledge around family caregiving? So that's one thing that's kind of being done in the caregiving realm from the master plan. I'm excited.
All right, so I think we're winding down, but I want to, if you have any last questions and you want to go to the microphone, but while anybody's thinking about their last questions, I just want to say, do you have any final words of advice, or anybody have any final thoughts for our group of 300 people who care about caregiving and respite?
Well, they care about respite
Respite
and caregiving.
and caregiving.
Yeah. My final thought is patience. It is going to absolutely take a long time, but because we're aging into this process, everybody, the legislators, everyone is going to be impacted by this. You've heard it over and over, but it's so true. And so just be persistent. And I was talking, okay, who was I talking to who talked about the little steps? Someone said you have to keep, you know, it's like the first step toward a marathon is the, you know, step in the first mile. That's where we are.
Andrew, any final thoughts? And when can we expect, what are we expecting out of New York's plan timeline, or I haven't?
So our timeline is we have an advisory report to put together for this summer that'll lay out sort of a prioritization of what was generated so far. And then the final master plan recommendations are due in January of 25.
Exciting.
And I want to say two other things. First of all, California did an incredible job with philanthropy, and I'm deeply jealous of what California was able to do with philanthropy and funding their process. And if anybody else is trying to put together a state master plan for aging, look at what California did with philanthropic support for their process, because it's incredible with the agreements and the coalitions, and the SCAN Foundation was a big part of that. It's just fantastic what California was able to do. And then the other thing I'll say is I have been name dropping like a disaster during this presentation. But part of it is because the coalition is the point.
Yeah.
The point of this is not just to get good ideas. It's that everybody needs to build relationships to work together for the long term to bring this into reality. And that's been one of the big lessons of this process.
I would say, you know, that your question made me think of this, is when we're writing our master plan, we're going to write it for the state level, but we're also going to have toolkits for the regional councils, for cities, anybody that wants to do it on their local levels and be able to get that data locally and see how they can impact aging. So I think that's an important part of that. I also would say if you have the chance to join the learning collaborative that they have for the master plans on aging, it is excellent. That's how I met Andrew and several other folks. And it really does help to hear from other states what's worked for them, their lessons learned, and then the great resources that they can share. So thank you.
Thank you. I'll say we love working with states that are working to build buy-in. You know, it's if you're in a state and you want to build buy-in, that's something that we enjoy working, and we love to see how it then kind of comes to fruition. So I want to thank you all for engaging with us today and listening to our talk, and I want to thank our panelists today for sharing your state's experiences. Thank you.
Another round of applause for our panelists. Thank you, and thank you, Carrie. So we're at the close of our conference. It's been a whirlwind few days. Thank you all for being here. I just want to shout out to the hotel staff, our AV company. They did an awesome job. We so appreciate them. We have a few things that we have to raffle, so Anne Marie's going to help me. And then I'm going to turn it over to Jill because she has an exciting announcement for us. Wow, we have more things than I knew. Okay. Washington? Is this from Washington?
Wisconsin.
Oh, Wisconsin. Oh. All right, Anne Marie's going to draw. Wisconsin, Chris McGrain. Are you here? We have a bag from Colorado. Lovely. Thank you, Colorado. Thank you, Wisconsin. Stephen Fauci, Director of Caregiver Supports. Alabama. We love Alabama. Celia Brown, Lifespan of Greater Rochester. Celia, are you here? Oh, yeah. Idaho. Tina Urich from the Illinois Respite Coalition. We're almost there. Well, I thought we gave all the beer away yesterday, but we didn't. This is from New York. Larry Sparks, Inland Respite, Corona, California. I hope you can fit in your bag. Okay. It says hashtag raise respite and recharge, and who sent this to us? Shout out, come on, somebody. Nevada. Slippers. Yes, it's about relaxing. Everybody needs slippers to relax. Okay. There you go. And my name is State of Tennessee, Leanne McKnight. Are you still here, Leanne? Should we raffle it to someone else then? Because someone's got to take it. We're not taking it home. Well, I could use it. South Carolina Respite Coalition, Toy R. Pilot, Assistant Director. South Carolina, are you still here? Do you want to take it to her? There we go. Thank you, Amy. Somebody was, who won Idaho? Oh, do it again. Tennessee, Brian Dixon?
Okay, hold on. We'll get some.
That's what they get for skipping out early, you know? Doris Carp Diaz. All right, so thank you. This has been wonderful, and I am just so thrilled to have been a part of planning and executing this wonderful event, and I'm going to turn it over to Jill.
I think some of the panelists may have left, but we have Carrie Graham here, and I really want to thank that last panel because I thought it was fascinating. And for those of you who are in states that don't yet have multi-sector plans for aging, It's a fabulous roadmap for helping you implement the national strategy to support family caregivers. So like Idaho is advocating to move a master plan or a multi-sector plan for aging in their state, I encourage you to do the same. Or if your state is already engaged in a plan, that you get involved as well, if possible, to make sure caregiving and respite are mentioned in the final plan. So thank you very much, Carrie. That was wonderful facilitation, great questions, and I learned so much about what's happening across states, so thank you. I don't know about you all, but people have been coming up to me and saying, after the first session, saying, this was such a great conference. I said, it's hardly started yet. And I've been getting those same comments from people throughout the whole 2 days. So I had a fabulous time. I learned so much from all of you. So thank you all for being here. I hope you all had a great time.